Welcome back, guys. Just wanted to show you all this before starting the video. 96%, guys, 96% of the people, almost 97% have not subscribed while watching the videos. Guys, I really request those people who are watching the videos and not subscribing, please do subscribe to the channel if you think and you appreciate my work, then please subscribe to the channel. Okay, now let's proceed to the discussion from question number 141 to question number 150. Okay, so this question that there was a image of a person who had a bullet injury to his face, and the options were like it was a firearm injury which was given, and the options were like pistol from intermediate range, rifle, shotgun near range. So so my answer to this question is unpopular opinion. I don't think like many people think that this is the answer, but I feel so. This is the answer. I think the answer to this will be shotgun from near range, because actually apart from the entry wound, you could see that there were a number of abrasions type of thing that you get from like pellets of shotgun close to the entry wound. So I think that. Well, I have marked this answer and I think it should be shotgun, but let's see. It may be wrong. Question number 142, the image was given of packet type thing and the content was mentioned and asked what it is. So the answer for this will be Ringal lactate. It had Ringal lactate and the content was similar to Ringal lactate solution. So that will be the answer. Question number 143 is features of microcytic hypothermic anemia was given and other history was mentioned like regarding infections or something. I don't remember, but they said that the HPLC is showing increase in HbA2, increase in HbA. Increase in not HbA, it will be increase in fetal hemoglobin, increase in HbF, and increase in HbF. And also they had mentioned something on HbS. They didn't mention that it is something they had told about HbS. But and the options that was confusing was either sickle cell anemia or thalassemia. But since they have not mentioned any history specifically for sickle cell anemia, like any acute attacks or any crisis or something, and also since there most important there's increase in HbA2 and increase in HbF, so I think the answer to this will be thalassemia. Question number 144 is a hypertensive patient. Was non-compliant with his medicines and arrived with sudden shortness of breath. An X-ray was given of the chest region, and it showed mediastinal widening. I think it showed mediastinal widening. So something it is probably related something to aortic dissection or tear probably dissection. I think tear probably. And the answer to this I don't remember the options, but I have marked. I think there was some option about something about nitrate, crystal trinitrate or something, so I've marked that as the answer. Um, till now, no teacher has discussed this thing, but I think this should be the answer, nitrate. So question 146 was secondary prophylaxis for rheumatic heart disease. Okay, so this question is like a repeated question. They do ask this thing, and luckily I studied it before the exam. So secondary prophylaxis for RHD in a 13-year-old child with no features of carditis. Mother, she had an active infection, but she did not have any carditis or remnant valvular disease. So what will be the thing? The options are like 10 years or until 21 years, whichever is longer. 10 years or until 40 years, whichever is longer. Basically, this is done if there is carditis but no valvular features, then we go for this. And till 40 years or until 40 years, this is done if this carditis plus valvular disease. And this will be the answer 5 years until 18 years of age. That will be the answer for this question. Question number 47. Minimal change. This is all true except. Okay, so for this question, I'm confused whether they asked was it which is true statement or all true except. So if it is all true except, then the answer will be effacement of photocytes is seen in light microscope, because this is the wrong statement. Wrong statement because in the light microscope we will not be able to see the feature. This feature is of the electron microscope feature. Effacement of photocytes. So this should be the answer. If they have asked all true except, please mention in the comments. Image shown there was an image showing a solid mass at the angle of the mandible, which is painless and just solitary and solid mass. So this is also like a topic of discussion. Many people are saying different answers. Some are saying osteoma, some are saying resolved abscess, and some are saying parotid swelling. But according to me, they have not mentioned about that. in the classical finding that we get in the pleomorphic adenoma. That what was that called? Tapering something, tapering appearance. But the answer I think should be bad weight swelling because if it would have been visual abscess, then it should be painful, I think, and even in osteoma of the jaw. So I think it should be bad weight swelling, maybe. But I'm really doubtful in this question. Question number 49. As a MO of the PSC in a seismic zone, what are the steps to be taken by you? So, in this question, the options are like disaster. You will perform disaster simulation to see the response. Will increase the resources for preparedness, and will give the instructions on loudspeaker. And there was one more option, and we have to select among these, like which are the options that are correct. According to me, I think this is right statement. This is a right statement, and this is a right statement. And the fourth option was actually, I think, the right statement, but I don't remember the option. And I don't think this is the. I felt this was the least likely out of the four. And the options, there was one option where this three was correct, so I have selected that. Question number 150. The at-risk infants are. So in this also the options were such that made you confused. And also one of the option is this, that birth weight 2.5 kg. Now actually if the birth weight is less than 2.5 kgs, then it's considered as at risk. But yeah, but they have not mentioned whether it's more than 2.5 or less than 2.5. And they have mentioned single mother. Single mother is a at-risk thing. And this one is like God knows what, artificial feeding and birth order of three or more. So this question, guys, tell me what you think. I think, I think, um, I think they have, with this, they are trying to mean that it is an at-risk infant. So the option containing both of these should be the right answer. Let's see what happens. Thank you guys for watching. Please subscribe to the channel. 94% of the people are not subscribed, guys. So please subscribe to the channel. Thank you.